Today, we're going to talk about a rare condition, Stevens-Johnson syndrome, and how it affects the eyes. Welcome to EyeTalk with code EyeCare, and I am Dr. Geetha Iyer. One of the most common questions people ask us, what exactly is Stevens-Johnson syndrome? Stevens-Johnson syndrome, or SJS, is a severe reaction in the body that is most often triggered by an allergy to certain medications. Sometimes it can also occur after infections. The condition causes severe inflammation and ulceration of the skin and the mucous membranes. Patients are usually very sick and often require treatment in the intensive care unit. At that stage, the medical team is rightly focused on saving the patient's life. But another important question is, can Stevens-Johnson syndrome affect the eyes? Yes, it can. The same inflammatory reaction that affects the skin can also damage the surface of the eye. During the acute phase, which is within the first 2 weeks after the onset of the disease, the eyes can become red, painful, extremely sensitive to light. The surface of the eye can also develop ulceration and inflammation. Another question patients often ask is what happens after the patient recovers from the initial illness. Even after the skin heals, the patient recovers from the acute illness, the eyes continue to develop long-term changes and complications. Patients may experience severe dry eye, they may develop intense sensitivity to light, the cornea can develop scarring which can reduce vision. In some cases, these complications can become vision threatening. This leads to another very important question. Should patients with Stevens-Johnson syndrome see an eye specialist even if they feel that their eyes are absolutely fine? The answer is yes. Every patient who has had Stevens-Johnson syndrome or toxic epidermal necrolysis should have a proper eye examination. Regular follow-up with an ocular surface specialist is extremely important. Today, we have several treatment options depending on the severity of the eye involvement. These treatment options can help improve comfort, they can control the inflammation, they can protect vision. In advanced cases, specialized procedures such as artificial corneal transplantation, known as keratoprosthesis, may also be considered. The most important message is that early care and continued follow-up can make a significant difference in preserving vision in those affected by Stevens-Johnson syndrome. Take care of your eyes. They are the only pair you have.